Hello and welcome to today's webinar called COVID-19 Education for Bayfield and Ashland Employers. My name is Carrie Lascala. I'm the Associate Director of Health Literacy at Wisconsin Health Literacy. And today's agenda is right here, and I'll get to that in just a minute. But a couple things I wanted to share with you before we got going is, number one, I hope you have a copy of the slides today in PDF format. But it's okay if you don't, because at the end of this presentation, I'll have my email address up and I'll leave that, and you can write that down if you need to contact me. And the reason why I say that is because I do provide a lot of links to different resources, including the Centers for Disease Control and Prevention, or the CDC. I'll be mentioning them a lot today. I also link out to the Wisconsin Department of Health Services website, as well as a few others, and also news articles. So I don't want you to have to write those all down as we're going through. You can just get those from me at the end if you don't have a copy of them with you right now. The other thing I wanted to let you know is that I'm not a doctor. And so if you have any questions as it relates to COVID-19 and your health, please be sure to reach out to your doctor or your nurse or provider right away and ask any questions that you might have. I also wanted to share with you that COVID-19, it's considered a novel coronavirus, and novel means it's new, so it hasn't been identified in humans before. And so although scientists and doctors know a lot about COVID-19 right now, there still may be things that they don't know or that we may learn as we go forward through this pandemic. So again, any questions you have as it relates to your health, be sure to reach out to your doctor or provider. Okay, so for today's agenda, we're going to talk about COVID-19 pandemic in general. We're going to also talk about the importance of face coverings or masks. We'll discuss how to protect staff and customers under COVID-19, how to keep facilities as clean as you can under COVID-19, what to do after a worker has tested positive, and how to manage stress under COVID-19, because I think that is something that many of us are feeling these days. A little bit about Wisconsin Health Literacy. So we are located in Madison, Wisconsin, but we're actually a statewide nonprofit organization, and we offer education and training on health literacy throughout the state. We do a lot of community projects. One of the ones most recently that we have completed was called Let's Talk About Pain Medicines, where we were working with community members on how to more safely and effectively take opioid pain medication. We're a division of Wisconsin Literacy, which has over 70 members that are literacy organizations across the state of Wisconsin. And one of our member organizations is called Lake Superior Tutoring Center for Dyslexic Children and Adults, and it's in Iron River up in Bayfield County. We also do a health literacy summit every other year, but like everything else that has been happening, COVID has made us postpone that. So we were supposed to have it this spring, but that won't be happening now until the following year. Here are just a couple of pictures where we're out in the community or doing different presentations that I wanted to share with you. All right, so we'll go ahead and get started on our first topic. So first, we're going to just talk about COVID-19 in general, and I'll share some facts and figures with you. It is a respiratory illness, so it's very contagious and can be spread between people who are in close contact. And they're saying right now, like within 6 feet, so you might have heard that people should stay 6 feet apart, and we'll talk more about that as we go through the slides. You can get coronavirus through droplets when an infected person coughs, sneezes, or talks. And they also believe that you may be able to get coronavirus by touching a surface or an object, so maybe a table or a handrail or a handle or a computer or any kind of object that has the virus on it, and then you've touched it with your hands and then touched your face. And so they believe you can get it that way as well. It has affected the whole world. Here in the United States, as of the middle of December 2020, we have around 300,000 deaths, and Wisconsin's deaths are about 4,300. And the symptoms can really range. There's a wide range. You can have no symptoms but still have COVID-19, but you just don't know it. You can have mild symptoms where you're a little bit sick, or you could be really sick, or you can even die. So here are some of the signs and symptoms of COVID. It could be a cough or shortness of breath or difficulty breathing. You could have fever or chills, or feel really tired or fatigued, sore throat, runny nose and congestion, muscle or body aches, headaches, and then also this too, this new loss of taste or smell. If all of a sudden you can't smell things or you've lost your sense of taste, that could very well be a sign of COVID. You could also have nausea, diarrhea, and vomiting. And these are just some of the symptoms that we know about. There may be more. If you're, again, having any trouble with any of these symptoms or worried about any of these symptoms, it's important that you call your doctor right away. There are certain people and groups of people who are at higher risk of more severe illness. And what we mean by severe illness is if somebody has to be hospitalized because they have COVID-19, or if they have to be admitted to the ICU or intensive care unit, if they need a ventilator, or if they've died. So those are, there are certain people who are at risk for more severe illness. Now, anyone can get COVID-19 and anyone can have, be at risk for a severe illness, but there are some categories of people who are at higher risk just in general, and that's older adults and also any adults that have cancer or chronic kidney disease, sickle cell disease, who smoke, have heart or lung disease. Some of the things that they talked about with heart disease, maybe heart failure or coronary heart disease, or chronic obstructive pulmonary disease, COPD, those who are obese or pregnant or have type 2 diabetes or weakened immune system. And again, there could be others as well. And here is a link to the CDC website where you could go ahead and check out that website, and it talks more about these conditions and the nature of who might be at high risk, and including older adults and any adults that have those conditions listed above. But there could be others as well. So when to seek emergency care? It's important to seek emergency care when you're having trouble breathing, or if you have pain or pressure in your chest that won't go away. If you have new confusion, so all of a sudden you're just feeling confused, that could be when you need to seek medical or emergency care. If you can't wake up or stay awake, or if your lips or face are blue. And again, there may be other symptoms here, and always call your doctor for any symptoms that worry you or that are severe for you. So now we'll go ahead and we'll talk about how we can prevent the spread of COVID-19. One of the things that we can do is stay home as much as possible right now. Maybe we cancel events and we avoid groups of people, and we avoid having our kids have children in the house. That's going to be really important. Another thing that's going to be very important is wearing a mask, and we'll talk about that shortly. And the other thing is staying 6 feet apart from other people as much as you can. That's also really important. And then also washing your hands often using soap and water, and washing for 20 seconds at least. One thing to think about, we do have a vaccine coming now. It's being distributed now through the United States, which is good news. The only issue is that it may take a while before it's widely distributed. And the director of National Institute of Allergy and Infectious Diseases said that we may still be needing to wear masks and staying home more, or staying 6 feet apart for quite a while yet. And so that's something to keep in mind too, as you think about keeping your businesses safe, that we aren't out of the woods yet. And it still may be several months. This director was saying maybe into the summer or even next fall, of when we have to keep protective measures while this vaccine is being distributed. So just something to pay attention to and keep in mind. All right, So let's go ahead and talk about the importance of face coverings or masks. So this is a very important way to help stop the spread of COVID-19, and just some tips on how we can go ahead and use it so we're using it properly. So wash your hands with soap and water, or use hand sanitizer before you put it on your face. Make sure you put your mask over your nose and mouth. So sometimes I've seen people, they have it down over their nose. It's really important to put the mask over your nose and your mouth, and then pull it down over your chin. And then make sure there are no gaps between your face and the mask. The other thing that's really important to remember is to try not to touch it while you're wearing it. That is a lot easier said than done. I know I have done that before, but it's just really important, if you can, to not touch it while you're wearing it, and to make sure that you can breathe easily. So a mask is one thing to do. It's not 100% foolproof. You still need to try to social distance as much as you can. Stay 6 feet apart. Wash your hands. But this is one of the many important steps to help stop the spread. So when to wear your face mask or your face covering? Recently, the CDC has come out now, because we've had such a high increase in the number of cases in the United States, and they're actually asking that we do what's called a universal mask use. So we're wearing it anytime we're indoors, outside of your home. So even now, if you're at a neighbor's house, you should wear it indoors. And then outside when you can't be at least 6 feet apart. And they also said that you should wear it in your home. So even in your own home, if someone you live with has COVID or has been exposed to COVID, or if someone in your home works in a high-risk job, so high risk means they're at high risk for getting COVID, so that may be a meat packing plant or someone who works in agricultural processing. They do recommend, there are situations when people should not wear a mask, and so then they would have to think about alternative measures to stay safe. But it's for children under 2, they don't recommend that they wear masks. Or if someone has trouble breathing, or if you can't take the mask off by yourself. And then there are times that there are certain people who may have some behavioral problems or cognitive issues or sensory issues, and wearing a mask may be really challenging for them, and so they may not be able to wear a mask. The other things to keep in mind when you're wearing a mask is how to keep it clean. So if you're wearing a cloth mask, the CDC recommends that you wash it each day that you use it. You can throw it in the laundry, or you can wash it in the sink with soap and water. The thing is to make sure that you keep it, that it dries thoroughly. So that's going to be important, that it dries thoroughly. And you can also, if you're wearing a disposable mask, they just said to get rid of it after you wear it once. So how to handle someone who will not wear a mask when they come into your business. So that has happened, as you've probably seen on the news. And there are some ways that you can try to help manage this, or try to not escalate the situation, try to keep it as under control as you can. And one of the things is to make a mask policy and make it clear with a sign. So have your mask policy somewhere outside your business, or on your window, or in your business, where it's very clear, it's visible, it's readable, you can understand it, and it's non-negotiable. It just means you're not going to argue about it. I was up at a business this past fall, and I saw this sign, and I thought it was really great and to the point. And it just said, no mask, then no service, no debate, no time, busy running a farm. So I think that's a good example of of a sign that is right to the point, and it's easy to read and understand, and non-negotiable. So how can you handle, though, if someone still refuses to wear a mask? Here are some things you can think about doing. You may be able to give away masks for free in your business. So sometimes people might just forget it at home, or they've left it in the car, and it's going to take them a while to come in and go back out and come back in. So if you can give masks away for free, that might be a great solution. You can also offer other service alternatives. Maybe you can do curbside pickup or delivery. You can also make sure you're supporting your employees. So if your employees are enforcing your mask policy, make sure you support them. One of the best things you can tell them to do is to tell them they should let people know this is the company policy, I'm following company rules. And then that way it takes out the personal nature of it, where it's not somebody trying to say, hey, you can't do this. This is just a company policy that they're following. It's important to keep your emotions in check. Try to treat the person with kindness, even though that may be difficult, but just calmly state the policies, but don't engage in arguing. It's not worth it. It's not worth somebody getting hurt or worse. And then you might also have to consider just firing a customer if needed. And I know the old saying is the customer is always right. I've actually never really believed that. But maybe that's really important here. If a customer just won't comply with your mask policy, maybe just don't do business with them for the time being. And then if worse comes to worse, you could call security or police if it ever got to that point, which hopefully it wouldn't. So how can you protect staff under COVID-19? And it's really not just staff, but it's also your customers as well. So having a good business plan in place is a great way to start. And I'm going to take you out to the Bayfield County Health Department and show you this PDF. I'm not going to spend a lot of time on it. I just want you to be able to see it and know that you could download this and keep this in mind for developing a good prevention plan for COVID and how to keep your employees and the community safe and your customers. So it's right here. And again, like I said, I'm just going to go through it kind of quickly, but I just wanted you to be able to see what this is all about and that this is something you could consider downloading and filling out. All right. You can also go to the state of Wisconsin, right here to this website. They have a lot of information and resources as it relates to COVID-19 for employers. One of the things you want to think about with a good business plan is to just draft the plan before you need it. You just want to, again, be proactive rather than reactive. So you're taking care of things before they might happen rather than scrambling and trying to react to it after someone has been exposed to COVID. You might also need to consider changing or revising your policies. So maybe your sick leave or your paid time off or other types of leave. Another thing that you can do that I found on the website is you can call or email for a free risk assessment, and it's called this WISCON program right here. And I believe that you can do that either prior to someone having COVID in your business or after. So that's just something you can keep in mind as well, and to reach out to them for some sort of free risk assessment. Another way to help minimize the risk in your business is, again, face masks should be worn. That's really important. You might want to consider screening your workers for symptoms. The only thing to keep in mind, though, is what we talked about earlier, is sometimes people don't have any symptoms and they do have COVID. So if you were doing a temperature check, for example, they might not have a fever if they don't have any signs or symptoms. Another thing, so you can do that, but another thing you can also do in addition to that, or at least separately, is just talk to your employees about the signs and symptoms of COVID and to make sure that they should stay at home and call their doctor if they're not feeling well, so that they're not coming into your place of work. If people do work in close contact with others, they may need other personal protection equipment. So yes, the face masks are great, but they may need some of these other personal protection equipment things like goggles or face shields or gloves or gowns. The thing about gloves though is they have to be used correctly and removed correctly so that nobody's touching the gloves that may have some kind of contamination on it and getting rid of them properly. And so that's one thing to keep in mind with gloves. It's also important to promote hand washing with your employees and keep hand sanitizers in many areas throughout your business so people can use that as often as they need. You also want to inform and keep your employees educated. And so, again, any policy that you put in place, make sure that your employees know about the policy. If you do have any signs, then make sure, again, those are visible and readable and understandable. And again, that would be for your not only your staff and your employees, but for customers. So maybe you have one entrance into the building now and another way to exit. Make sure those signs are clear, or signs that say if you're not feeling well to stay home. Whatever policies you want to put in place or signs, just make sure you're informing your employees about that. You may need to take extra precautions with older workers or any adult at risk for severe symptoms. So what we were talking about earlier with some of those people who might be more at risk for severe symptoms. Again, making sure your employees stay home if they're sick. If an employee does come to work with symptoms or develop symptoms while they're at work, be sure to separate them immediately from other workers. Give them a mask if they don't already have one. Make sure that you send them home and give them instructions on consulting with their doctor. And then they must follow health department guidelines before returning to work. Some other workplace changes due to COVID-19, encourage social distancing. So as much as you can, keep staff and customers 6 feet apart from each other. You may have to use tape or signs to show people where to stand because it's hard to really gauge what 6 feet is. So using that tape or signs will help people just to know where they should be. You might use different shifts or stagger your shifts. So you have different start times and break times so that not everyone is working all together or taking breaks all at the same time. And then you can also clean in between shifts, and we'll talk more about cleaning in a little bit. You also want to encourage, again, that frequent hand washing. Commuting to work separately, that might be kind of a pain because it is nice to ride with people together. You know, employees can commute together, but for the time being, it's probably safer if people can arrive separately to work. You can also consider your employees working in pods so that you have the same group of employees working the same shifts as much as you can. That way, if someone does come down with COVID, you can hopefully just worry about if anyone else is infected who was working with them in that same pod, rather if they were all working different shifts and all working at the same time and with different people. That's going to be a little bit harder then to try to figure out who might have COVID or who you need to contact. Use in case they were to get this themselves. You also have to, it's also best if you can use stairs instead of the elevators so you're not in an enclosed space, so stairs might be better for that. Things you want to discourage them from doing handshakes or hugs or fist bumps. And also the other thing you should consider or could consider are installing shields or barriers to separate workers if they can't be 6 feet apart. So you've probably seen those plexiglass barriers and shields at a grocery store, and that keeps the customer safe as well as the person checking them out at the grocery store or whatever business it may be. Other workplace changes that you could consider is encourage work from home options if that's a possibility. Do virtual meetings, so Zoom meetings or whatever platform you might use. Or if you have to hold it in person, make sure it's in well-ventilated areas and that people are sitting at least 6 feet across. You might want to implement touchless payment options, so maybe people can use the internet to pay or they can call in over the phone, or people are able to use their phones and they could make payment options that way, so they're not touching screens and they're not touching keypads. And so those are options to consider as well. You may also have to consider downsizing your operations temporarily, or using, again, that curbside or delivery pickup. And then also discourage employees from sharing phones or desks or offices or office supplies if you can. If that's not possible, just sanitize before and after use. And I'm going to tell you, this is a good website here too. It's also a PDF, and I'm just going to show you that as well. And it's on the Wisconsin Economic Development Corporation website. And so I'm just going to show you this, but it gives a lot of good information for employers. So it's this here, and it's pretty long. It's about 8 pages, so I won't, again, I'm just going to go through it very briefly, but this is something you can check out later on the website and use that link to get to that website. My computer's having a little bit of trouble pushing this down, so I might not go all the way to the end, but just wanted to show you that this is also available. Oh, and it also gives a lot of resources and references as well, and so that will be helpful for you too. All right, next we're going to talk about how you can best keep facilities clean under COVID-19. And so a lot of the stuff I'm going to talk about right now is just keeping it clean in general in your facilities, in your businesses now in the time of COVID. And then there is also specific information about how to proceed if there has been someone in your office or building that has COVID. But for now, I'll talk about this first and some of the steps you can do and take to keep your businesses as safe and clean as you can. Again, I found a lot of this information out on the CDC website. There is a ton of information out there, but I will show you the link towards the end of the slides. But one of the first things to do is just make sure people are wearing disposable gloves, that you're cleaning surfaces with soap and water first, and then use disinfectant. You may need to just clean surfaces more often now. So things that are touched often, whether it's tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, sinks, whatever you have in your business that are high touch areas or high touch surfaces, you're probably going to have to clean more often right now. Using disinfectant, that's important too. And there's a lot of information on the Environmental Protection Agency, and they do have quite a bit of information specifically as it relates to how to determine if the disinfectant you have kills COVID-19 or what disinfectant to use. I will say it's a little challenging to read through some of this stuff, but I'm going to show you this website so you can just see it and become familiar with it, or at least have see it before you were to check it out later. So right here, you would go ahead, so again, it's the Environmental Protection Agency website, and you would click here to find a product to kill coronavirus, and it gives you different ways in which you can do that, either by the EPA registration number or active ingredient or some of this other information, and it pops up here. Again, it's a little challenging to read and understand. They have put out a video to help you use the list, and it's only about 3.5 minutes long. So that may be something that would be helpful for you to use that list so you can try to figure out if your disinfectant is one that will kill coronavirus. They also talk on the website, or on this website, the CDC website now, is what you can do and how you can use diluted household bleach solutions if you can't find a disinfectant. But again, you would really just want to look at those directions and follow those directions to the T, so that you're doing everything right and making sure that you or your employees are staying safe when using this. For those disinfectants, you have to make sure that those instructions are being read very carefully to stay safe. Some of the things that they talked about is, just covering the skin and wearing proper eye protection. Make sure there's good ventilation when your employees are cleaning. Only use the amount recommended. Don't mix chemicals together. Clearly label the cleaning solution and keep out of reach of children. And there is information on there too if someone has asthma and that they may not be able to use some of these disinfectants. So this is just a good website to check out and to know what to use and how to keep employees safe. So some general information about cleaning soft surfaces. So for carpets or rugs or drapes, clean with soap and water or with cleaners that are specifically made for those surfaces. You can launder if possible, so throw it in the laundry if you can. Use the warmest setting and dry completely. You can also use disinfectants if it's appropriate, and you can vacuum too. Other things to regularly clean are probably your electronics. So for tablets, touch screens, keyboards, remote controls, and ATM machines, if you can, use a wipeable cover on your electronics. That'll make cleaning this a lot easier. So that's something you can do. If it's not possible, then make sure you're following the manufacturer's instructions on how to clean those specific electronics. And if there are none, the CDC says you can use alcohol-based wipes or sprays containing at least 70% alcohol. Laundry. So throwing things in the laundry like clothing, towels, and linens. It's important to follow the manufacturer's instructions. Use the warmest setting possible and dry items thoroughly. Wear disposable gloves if you're cleaning laundry from a person who's been sick. According to the CDC, those items can still be washed, though with other people's items. Just don't shake the dirty laundry so that germs are being spread all around. Clean and disinfect hampers, and then make sure again that you're removing gloves and washing hands immediately after cleaning. Cleaning outdoor areas. So maybe you have to clean playgrounds in schools and parks, or you're a part of the business that works with playgrounds and schools and parks. Here, normal cleaning is okay. You don't have to worry about disinfecting. And you're really talking about cleaning those high touch surfaces, whether it's plastic or metal, or the grab bars and railings. Those should be routinely cleaned. Sidewalks and roads don't need to be disinfected. And neither do wooden surfaces, such as wooden surfaces that are play structures or benches or tables, or ground coverings such as mulch and sand. Some other general cleaning tips. Regular cleaning staff can clean and disinfect community spaces. Wear disposable gloves and gowns. Again, personal protection equipment may be required, and those gloves and gowns should be removed carefully, washing hands immediately after gloves, especially if you've had contact with someone who is sick, but still washing your hands just in general is a very good idea. You can use hand sanitizer first, but be sure to clean off the dirt. Or I'm sorry, you can use hand sanitizer, but first clean off the dirt with soap and water. And then still some further considerations for employers: improving your ventilation with your local HVAC professional. That might be something you want to do. Develop policies to protect employees and provide training to all staff. Make sure employees are trained on the hazards of cleaning chemicals. And there's also information here on this website. There's a bunch of information there, but there are also information about how to comply with OSHA standards when needed. And so this is a really good website to check out. Okay, so what to do after a worker tests positive? So steps to take: you don't automatically have to shut down your business, but you do need to work with your local and tribal health department to stop the spread. Again, you can get that free facility risk assessment. I do believe that's either before or after an employee gets COVID. And again, it's that WISCON program. And here's the phone number and the email address in which you could reach out to somebody. And then more information can be found here. And I'm going to take you out to that PDF in a couple minutes as well. But we're going to first just talk through some of these steps. So the first thing to do when an employee has tested positive for COVID-19 is to close off the area that was used by that person. If the person happens to be at work, be sure to move them to a spot away from other people, have them put a mask on, and send them home. And then you'll have to also clean and disinfect. And it's better if you can wait 24 hours or so before cleaning, or as long as possible, so you just don't have people going in there into the areas where the person with COVID had just been, or even if they've been there recently, you just want to try to wait 24 hours before you can start cleaning, or as long as possible. And also you'll want to follow those CDC guidelines on cleaning and disinfecting. There is more information on the CDC website about that. We talked a little bit about disinfecting just in general earlier, and then just more specifically when someone has tested positive for COVID in a business. And they get into more specifics on the CDC website, like what kind of vacuum cleaner to use, and they recommend a high efficiency particulate air filter, or HEPA. If you can use that, that will be helpful. It also gives information on the CDC website as it relates to what to do with your HVAC system. And so I would recommend following that and looking at that. Talking about HVAC is not my strong suit, it's not my area of expertise, but they give more information on the CDC website on what to do as it relates to that. And then you also want to be sure to open doors and windows to increase air circulation in the area as best you can. The other thing that you must do is you must call your local and tribal health department when an employee has tested positive for COVID. And I'm going to read exactly what this says, and I'll actually show you this too on the document when we link out to it. But it says, if a worker has tested positive for COVID-19 as self-reported by the worker or in a test arranged by the employer, you must follow state law to report cases to the LTHD. Again, that is the local tribal and health department, even if the coworker does not have symptoms. So Bayfield County, I think this is where you will contact. This is the health department, your health department contact information right here. And then Ashland County, this is your department that you would contact here. The next thing that this PDF recommends is that you collect the information that is needed to share with the local tribal and health department. And so here we're talking about who did this person come in close contact with, and they might, because then they will probably have to reach out to those other employees and talk to them about their risk of exposure and of getting COVID. So you'll have to collect that information. Again, you would work with a local tribal and health department. They can help you with this kind of information that you need to collect. And then you must also inform fellow workers who were in close contact with the person who was infected with COVID. At the same time, though, you have to maintain employee confidentiality as required by the Americans with Disabilities Act. So I would work with the person in your human resources department. If you have questions, again, I would refer back to your local health department and talk with them about that. Maybe they can help you, or they can give you some recommendations on who to contact to get help with that. Then the other thing that they can work with you is they can work with you on a best practices communications plan. And so they can help you, and you would be able to share some general information, and they would talk with you about what you can share with the public about how you are working with the local health department to keep the community safe. So this is probably a really great idea if you want to get it out into the public about what you're doing to keep your business safe, to keep the community safe. And again, working with your local and tribal health department, they'll be able to take care of that and work with you. And then finally, the other thing is you'll need to report any work-related COVID cases to OSHA. And this is the PDF, and we're going to link out to it now because I just want you to take a look at that so you can see what I'm talking about. So it is right here. And again, I'm just going to go through it fairly quickly, but I want to just point out a couple of highlights here. So it's an introduction. It says this document assists employers when a worker tests positive for COVID-19. It describes how to work with the local and tribal health departments to help keep workers and customers healthy and keep businesses running smoothly during the pandemic. And some questions that you'll need to address. And here it says, although working with the LTHD is required in state statutes, this document focuses on best practices and a collaborative approach with public health that is needed to stop the spread of COVID-19. So again, just working with that public health department so we can try to stop the spread as much as possible. And it gives here checklists that you could go through or that you should go through. And then really just more detailed information in here. And so I think this will be really, really helpful for you to take a look at. And these were the steps that I just went through on our slides about what to do when a worker tests positive for COVID-19. And then they'll also be able to work with you and the employee about when they can return and come back to work. It depends on a lot of different factors, but in here it says something to the effect of ultimately it's up to the local tribal and health department. They'll be able to determine when the employee can come back to work. And it says that right here. Right in that sentence right there. So again, and then at the bottom of this, they give additional resources as well, which is nice to have. So resources there, and then just different things that you can have, like questionnaires and screening tools and information about reporting on OSHA and other things like that. They're all in, they have various appendices right here. Okay, so that's at the bottom. So again, this is a link on our PowerPoint slides here, and I can send this information to you separately if needed. So once again, to state again what we had talked about earlier, is just important to remember to continue these safe workplace practices for the foreseeable future. Again, even with this vaccine, this is still going to be important for a while until we are completely out of the woods, and we just don't know exactly when that'll be. So just these workplace safety practices are going to be necessary for quite a while. And that's the same with social distancing and using masks and being sure that employees are frequently washing their hands. So the last topic we're going to talk about is just how to manage stress during COVID-19, because a lot of people are feeling that stress right now, and no wonder. Pandemics are stressful, and I think most people would agree with that statement. And so stress can really cause a lot of the following things. You might be worried about your health and safety. And maybe even if you aren't worried about your own health and safety, you probably are for somebody you love. So there are lots of people that are getting sick, and a lot of people who could get, or any of us could get COVID, but a lot of people who are at higher risk. And so there's a lot of concern there about everybody's well-being and health and safety. Also, people are worried about finances or loss of support services that they used to be able to attend. A lot of places now, it's hard to attend these sort of support services in person. Although hopefully, some of these places are making arrangements and you can still meet virtually. But still, people are worried about this and they're worried about their financial situation. You may also experience changes in sleeping or eating patterns, or you may have difficulty concentrating or sleeping. If you have a chronic health or mental health condition, that may be getting worse under COVID, or other people might be increasing their use of alcohol, tobacco, or other substances. It's really important to take care of your health. So contact your doctor if you get sick. Know where you can get help. Reach out to somebody if you need to talk about any issues as it relates to your mental health. In addition to that, you can also just try to stay connected with others as best we can right now. Getting outdoors and staying 6 feet apart is a great way to see somebody. Maybe you can go for a walk with a neighbor or a friend, just again, keeping 6 feet away and staying outdoors. Other ways you can connect is virtually. So over a Zoom call or any other platform that you might use, or by phone or text. You can also stay connected with your community or other faith-based groups, maybe through again an online virtual platform. And it's also important to stay informed about the pandemic right now, but you probably have to balance that with not watching the news all the time, because if you do watch the news all the time, that can probably raise your anxiety level. And taking care of your health, continuing here onto this slide, taking care of your physical health. So it's important to eat as healthy as you can. Exercise, even short walks help, especially if you can get outside. Getting a good night's sleep, and again, the importance of not drinking too much alcohol or using tobacco, and don't use drugs. There's more information here on the DHS, the Department of Health Services website, as well as back here on the CDC website. And another stress that has come along with COVID is when we have children at home and they're doing virtual classes. So they aren't in school, but they're doing school from home. And depending on where you live, it's different throughout the state. I know where I'm living, my kids are 100% at home right now, and that is stressful. Other school districts have a combination where they're at home part-time and they're at school part-time learning. And then other districts might be completely in person. So it just really depends. But if you're finding yourself that your kids are at home during this time, that can be really challenging, especially if you're also working from home, or if you're not working from home and your kids are at home, that adds a lot of stress and different challenges. So some tips here that could be helpful is try to keep your kids on a schedule as best you can, try to keep your family on a schedule as best you can, but at the same time, understand that interruptions will happen. It's also important to ask for help. If you're really needing help or just some help, reach out to a family member, a friend, a neighbor, or a significant other to see if they can help you. Maybe they can pick up something for you at the grocery store really quickly, or help take care of your children for a little while, whatever the case may be. And then, of course, if you can also do the same for someone else that needs help, that's going to be great. Be sure to try to be open and discuss your employees' concerns as they bring it up during this time, and just be a good listening ear for them. And then, of course, it's important to take care of you as well as the employer. Take care of yourself, and then encourage your employees also to take care of themselves as well, in addition to their families or whomever else they may be taking care of. Talking a little bit about financial situation during COVID. Again, like mentioned earlier, people are losing jobs, and their finances may be in trouble right now. And so I read this article, and they gave some tips to try to help us at this time. And they talked about paying bills that are a priority. Of course, you always want to pay all of your bills. if you can, but they really focus on what is the priority right now, and it's the things that you need to take care of that will hurt you if you're not paid. So make sure your utilities are paid or other expenses, because you don't want those things being shut off. And so it's really to focus on those bills, and then communicate with those you owe money to. So maybe let your landlord or your mortgage company or anyone else you may owe money to know your situation and see if they can work with you to help you through this time. It's also important that you communicate with your significant other. Of course, a lot of I can't remember exactly how long ago this was, but I know a while back, and it probably is still the same, the number one reasons couples fight is due to financial situations or money. So that's probably being made a little bit worse right now under COVID. And then finally, you could also consider getting rid of expenses you don't need right now. And nobody likes to hear that. We like to have some of these things that are just enjoyable. But at the same time, if you have to balance that and get rid of it temporarily, that's probably a good idea. So maybe you can get rid of the Netflix subscription or magazine subscriptions or whatever you feel you really just don't need to have right now. And keep in mind, it's temporary. That helps when you have to get rid of some of these expenses. And then finally, once again, it's just important to remember that best practices for businesses may change over time. And so it's important to stay on top of this information. And here is a list of websites and resources. Again, the information from the CDC, as well as the Department of Health Services, and then also County of Ashland and County of Bayfield. They both have a lot of information on their websites. And so it's important to check these out. And once you're on these sites, you will find many links to different sites. And so you can find more information within these websites. And then finally, you could pass this along to your employees, and also just for you, it's just some more state resources. And it does say state COVID-19 resources, but I think this goes beyond COVID-19. And if people are struggling with things like housing or paying bills or mental health services, I believe they can call this number or text their zip code to this number, and they will be able to find resources to help them that way. And that ends our presentation. Thank you so much for joining us. I'm going to keep the slide up for a little while yet, so you could write down my email address right here in case you wanted to reach out to me. Again, I can send you a PDF copy of these slides or a link to these resources. I could actually just send you PDF copies of some of these resources too, if you need that. Or if you have any other questions, feel free to reach me at any time. And again, thank you. It'll be nice when we get through this pandemic and get to the other side.